Hi nurses. If you wish to sit for an exam in any of the licensure exams such as Prometric, DHA, HAAD, etc., the video is for you. The first type of question that you get in the licensure exam will be knowledge-based questions. So what do you mean by that? Knowledge-based questions will assess your understanding of your nursing fundamentals, medical terminologies, anatomy, physiology, and pharmacology. So let's see an example. Which of the following is a common side effect of ACE inhibitors? And they will give you options. So in this scenario, so what they are testing is your knowledge, especially if you know what is ACE, angiotensin converting enzyme, and what are the side effect of that. And in this scenario, I'm not going to discuss about the answers, and this video is particularly made to understand the type of question that you get in this licensure exam. Next type of questions that you get in the examination is scenario based questions. So we'll see what is that scenario. The questions present a clinical scenario for you and require you to apply your nursing knowledge to analyze the situation and determine the appropriate course of action. So let's see an example. A nurse is reviewing a client's maternal and prenatal record and notes that the mother used narcotics during her pregnancy. A primary nursing intervention when caring for a drug exposed neonate is to. The options they will give you: assess vital signs including blood pressure every hour, minimize environmental stimuli, place the infant in a well lighted area for observation, provide stimulation to increase adaptation to the environment. So in this you have to assess the mother and what she had. She had a narcotic use during the pregnancy, so you must understand what are the complications of a neonate which is born to a narcotic dependent lady. So that's how the scenario based questions work. The next would be the priority setting questions. As you all would probably know the word priority. The question require you to prioritize nursing actions based on the urgency of patient's need. So to add, I'll give you the question can be given a scenario of 2 3 patients. For example, they will give you 4 conditions of 4 patients and which one you need to prioritize. In another way, they'll ask you a single patient's 4 complaints. So from 4 complaints, which one you need to address first? It can be any kind of prioritization question. Let's see an example for that. The nurse is caring for multiple patients. Which patient should the nurse assess first? A patient with stable vital signs who needs assistance with ambulation. A patient complaining of acute chest pain. C. A patient scheduled for a routine medication administration. A patient requesting a glass of water. Now, the critical thinking questions. These questions require you to analyze information, make clinical judgment, and solve problems related to patient care. Let's see an example. A 30-year-old Gravida 3 Para 2 is being monitored. She is being induced with IV oxytocin or pitocin because she is overdue. The nurse notes the pattern below. The client is wedged to her side while lying in bed and is approximately 6 centimeter dilated and 100% effaced. The nurse should first A. Continue to observe the fetal monitor, anticipate rupture of the membrane, prepare for fetal oximetry, discontinue the pitocin infusion. So in this scenario, definitely you have to look through the pattern. Is it deceleration or acceleration? And you have to judge and you have to solve the problem. Therapeutic communication questions. These questions assess your ability to communicate effectively with patients and other healthcare team members. For example, a patient expresses fear about undergoing surgery. How should the nurse respond to facilitate therapeutic communication? Don't worry, everything will be fine. Surgery can be scary, but I'll be here to support you through it. You shouldn't be afraid, the surgeon is very experienced. Let's not think about the surgery right now. Is there anything else on your mind? If you like the video, please like, share the video with your nursing friends and subscribe the channel Nursing Exam Insights, your ultimate resource for all nursing exams. Thanks for watching.